Start the motion palpation assessment of the foot and ankle, right? So our patient's supine, and then from this position we can nicely assess the long Y-axis at the ankle mortise. So I have my patient on his back, the hip is flexed and abducted, and I've got permission to sit in here. And the purpose of this is to block the thigh with my torso, right? So I want to sit on the edge of the table, block the thigh with my torso. I'm going to make a thumb index contact right over the dome of the talus, and the other hand's going to come from behind above the calcaneus. Right? And from here I'm going to lean down a little bit so that I can leverage with my own adductors. So I've got a good grip on the structures below the distal tib fib, and I'll use my thigh and my hands to pull and open up the ankle mortise, the joint between the talus and the distal tib fib. You'll feel a swoosh opening. You usually can feel some good opening here. And if you don't, one doesn't have great opening here, it's an indication of a long Y-axis type of restriction. From this same position, I can perform long Y-axis at the subtalar joint. I'm going to zoom in on this just a little bit. And what I'm going to do is maintain this contact on the talus, and it's very, very firm. I'm holding on to it securely, and I'm also going to anchor it into my own thigh, right? So I'm squeezing the talus hard, not uncomfortably hard, but firm, and I'm pushing it into my own thigh. Then I'll grab the heel, right? And I'm going to move the heel this way, right? I'm going to kind of grab it and see if I can pull it away. And if I don't have a good grip on the talus, everything will move together. I won't accomplish what I'm trying to accomplish, which is long Y-axis of the subtalar joint. So I'll grab the heel firmly and see if I can appreciate a little give as I pull it away from the talus. From the same position, I can do inversion and eversion. The same principle applies in terms of gripping the talus. I have to have a very firm grip on it, and I'm putting an indent in my own thigh as I hold it there. I'll grab the calcaneus from the inside, and I'll push it down towards the floor and appreciate how much give there is. That's going to be eversion at the subtalar joint, the calcaneus on the talus. Then I'll use my digits, and I'll see if I can lift it up. That's going to be inversion. Okay. From this position, I can also check what we call spins of the mid-tarsals, right? I've got a grip here on the talus. What I'm going to do is take my other hand and place my thumb right over the navicular, right? And use a thumb index web to grab the whole foot right over the navicular and see if I can spin that down. See how much give there is when I try and spin that down. My hands are doing this. You can see how hard I'm holding onto the talus there. So this is downward spin of the navicular on the talus and calcaneus. All right. Then I'll move this contact over to the navicular. Again, I hold it into my thigh. Now I'm going to be on the first cuneiform, and I'll do a little bit of downward spin right there. It's not a lot of movement, so don't try and create a lot of movement. Everything will feel restricted if you just kind of bottom out the joints. Then I'll move this down a little bit more onto the first cuneiform. Now I'm going to be on the first metatarsal with my other hand, and again I'll lock the first cuneiform and the whole foot proximal to this into my thigh, and I'll spin this down. So it's downward spins. Now I'm going to do my upward spins, and I accomplish that by reversing hands. So now I'll use this contact over the talus and calcaneus, and I'll put this and I'll anchor that into my thigh. And then this thumb's going to go over the navicular, right? I'm going to take the navicular and see if I can move it upward a little bit. So upward spin. Then I'll move this contact over to the navicular, and my other thumb over to the first cuneiform. And I'll see if I can accomplish a little bit of that spin as well. All right. Then I'll move this contact over to the cuneiform, and again anchor it into my thigh. My thumb is going to be on the first metatarsal, the base of the first metatarsal, and again I'll see if I can accomplish that spin right there. All right, so those are all my spins. So the first thing we're going to do in this position is we're going to palpate the upward and downward spin of the cuboid. So in patients with very flat feet, the cuboid doesn't move up very well. All right? And in patients with very high arches, the cuboid doesn't move down very well. So with the foot in this position, what I'm going to do is from the inside, I'm going to stabilize the foot, right, the distal part of the foot. I'm going to find the cuboid, which is right behind the styloid of the fifth metatarsal, right there. I'm going to place my thumb underneath it on the plantar surface of the foot, and then I'm going to grab the top of the cuboid from the dorsum of the foot, stabilizing the medial side of the foot, distal to that. And what I'll do is I'll use my entire upper extremity to see if I can create a little upward spin of the cuboid, right? And then I'll do the opposite of that. I'll kind of change my grip a little bit. I'm on top of the cuboid right there, and I'm going to try and spin that down. So again, in a patient with very flat feet, there's usually a lack of this upward movement, right? And in a patient with very high arches, there's usually a lack of the downward movement. All right. From this position also, and I'll show this on this foot, I think the camera will see this a little bit better. We're going to check the pliability of the transverse arch. Right? So what we're going to do is find the first cuneiform, right? Just find that first metatarsal, find that first cuneiform. And I'm going to take my middle finger and place it right over the top of the row of cuneiforms. My thumb's wrapped around underneath the foot. I'm going to take my other hand, actually not my thumb, but my thenar is going to be on the bottom of the foot. Thenar and thumb on the bottom of the foot. Take my other hand and wrap it around the top like that, with my thenar on the outside of the foot, overlapping. So my thenars are overlapping, my thumbs are overlapping on the bottom planar surface of the foot. And what I'll do is when I have this position in place, I'm going to squeeze to see how much of give is there. This is pliability of the transverse arch, called the second cuneiform squeeze, because we're right in the center. All right. Patients with very flat feet, this will feel mushy. There'll be nothing there. Patients with pes cavus or very high arch, this may feel very, very stiff. Okay. So that's the second cuneiform squeeze. Pliability of that transverse arch. Okay, lastly, I'm just going to use my speeder board here because it's a little firmer surface. I'm going to keep the hip flexed at 90 degrees. I'm sorry, hip flexed at 45 degrees, knee at 90 degrees. I'm going to place the foot in a neutral position on the board. Just hold this thigh upright like that. With two thumb index webs, I'm going to grab the distal tib fib, and then I'm going to grab the talus. Right? I'm going to stand so that I'm perpendicular to the joint, and I'm going to shear the distal tib fib anterior to posterior on the talus below it. Okay, this is going to be A to P movement of the distal tib fib on the talus below. And then with my other hand, I'm going to push forward on the talus. That's going to be relative P to A movement of the distal tib fib. To do that, I'm going to stabilize with my knee right here, with my distal thigh right underneath the calf. Right, I'm going to stabilize that. I'm going to be pulling this way and pushing with my left hand. And that's going to be P to A movement of the distal tib fib on the talus.